सभी को मेरा प्रणाम। जैसा कि हम जानते हैं, आईएफपीएच एक अंतर्राष्ट्रीय मानवतावादी संगठन है जो विश्व स्तर पर होम्योपैथी आंदोलन और कार्यकर्ता को बढ़ावा देता है ताकि सभी चिकित्सकों और सामान्य जनता को एक ही मंच पर लाया जा सके। मैं डॉक्टर स्वप्निल, आईएफपीएच द्वारा आयोजित इस 1188वें दैनिक हिंदी वेबिनार श्रृंखला में आप सभी डॉक्टर्स का स्वागत करता हूं। आज का वेबिनार शुरू करने से पहले हम सभी 1 मिनट का मौन करेंगे। धन्यवाद सभी का। हमारे आज के मेहमान और वक्ता हैं डॉक्टर समर चटर्जी सर। बीएचएमएस और एमडी की योग्यता के साथ डॉक्टर समर सर को पिछले 39 वर्षों का क्लिनिकल अनुभव और 34 वर्षों का टीचिंग एक्सपीरियंस प्राप्त है। वे कई विश्वविद्यालयों में एग्जामिनर और पेपर सेटर रहने के साथ साथ सीसीआरएच की ड्रग प्रूविंग कमेटी के सदस्य भी रहे हैं। राष्ट्रीय और अंतर्राष्ट्रीय स्तर पर उनके कई शोध पत्र प्रकाशित हो चुके हैं। मैं सर से अनुरोध करता हूं कि वह अपना व्याख्यान प्रारंभ करें और अपने ज्ञान और अनुभव को हमारे साथ साझा करें। ओवर टू यू सर।
Yes, sir. Good evening, respected dignitaries. Today's chairman and coordinator, Dr. Sapnanil, Dr. Dhanesh, Dr. Inke Sahani. I would like to extend my gratitude to respected members of the IFPH, our Director of Genes Healthcare and Principal Hospital Superintendent of James Hospital, and all the well-wisher of the homeopathy, all the PG UG students. तो सर प्लीज फुल स्क्रीन कीजिए, अदरवाइज आई विल शेयर।
सर ये फुल स्क्रीन पे ही है।
ये फुल स्क्रीन है?
जी 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 सर।
हाँ, यू आर सीइंग द होल्स।
हाँ सर, पूरा कंटेंट आ रहा है सर।
लेकिन मेरा तो फुल नहीं आ रहा है, क्यों?
नहीं सर, मेरे स्क्रीन पे फुल कंटेंट आपका शो हो रहा है
फुल
सर।
कंटेंट आ रहा है?
जी जी जी, फुल कंटेंट है सर, कुछ भी
अच्छा,
मिसिंग नहीं है सर।
ठीक है ठीक है। तो तो हाँ, द टॉपिक इज बियॉन्ड द स्कैल्पेल होम्योपैथिक मैनेजमेंट ऑफ सर्जिकल केसेस। हम लोग का डे टू डे प्रैक्टिस में क्या होता है, हम लोग का प्रॉब्लम होता है कि सर्जरी केस को लेके क्या करूं, उसको छोड़ दूं और उसको ट्रीटमेंट करूं, और किस समय पर उसको हम लोग ट्रीटमेंट करूं, एंड इन व्हाट एक्सटेंट, इन व्हाट कंडीशन। टुडे हम लोग वही डिस्कस करेंगे। थोड़ा केस भी हम लोग एग्जाम्पल हम दे देंगे। फर्स्ट केस इज वेरिकोसिल। वेरिकोसिल, next slide please. Next slide. This is the, in the left side that is normal and the right side is the varicocele. It is a disease condition. You see that there is a venous plexus in the right side. Varicocele is the disease condition. So next slide. Varicocele is an abnormal dilatation and tortuosity of the veins within the pampiniform plexus of the spermatic cord, most commonly on the left side due to anatomical factors. It results from the incompetent obstructed venous valves. Venous valve जो obstructed होता है, incomplete होता है, insufficient होता है, इसीलिए venous stasis हो जाता है। एंड इंक्रीज्ड वेनस प्रेशर, उसके बाद यही वेरिकोसिल फॉर्म होता है, फॉर्मेशन होता है। नेक्स्ट स्लाइड प्लीज। हाँ, वेरिकोसिल often symptomatic but may present with dull scrotal pain, heaviness or visible swelling. On examination हम देखेंगे जी क्या हुआ, swelling हुआ, and prominent on standing, or it is prominent while the patient is standing or straining. It is a common cause of male infertility as the increased scrotal pain and temperature and oxidative stress can impair spermatogenesis. Next slide. Next slide, please. Yes. So when we advise for surgery, कब हम सर्जरी में भेजेंगे? जब देखेंगे कि इनफर्टिलिटी एक मैन के वेरिकोसिल कारण से हो रहा है और ज़्यादा तक एडवांस स्टेज हो गया, सिम्टोमेटिक रिलीफ नहीं हो रहा है नॉर्मल मेडिसिन से, तब हम लोग भेजेंगे. और बायलैटरल वेरिकोस कॉजिंग क्लिनिकल और रिप्रोडक्टिव कंसर्न, प्रोग्रेसिव वर्सनिंग द सीमेन क्वालिटी एंड प्रोग्रेसिव इनफर्टिलिटी, तब हम लोग इंडिकेशन फॉर सर्जरी एडवाइस करेंगे. नेक्स्ट, सर्जरी करने से क्या तकलीफ होता है, क्या कॉम्प्लिकेशन होता है? हाइड्रोसिल स्टिल रिमेनिंग हो सकता है, रेकर कर सकता है, रिकरेंट वेरिकोसिल हो सकता है, फिर आपस आ सकता है, इंजरी ऑफ टेस्टिकुलर आर्टरी हो सकता है ड्यूरिंग ऑपरेशन एंड सिंक्रेज होता है, इन्फेक्शन होने का चांस है, स्कोटल पेन एंड स्वेलिंग हो सकता है, ब्लीडिंग एंड हिमोटोमा इन स्कोटम हो सकता है, फेल्यूर टू इंप्रूव स्पर्म एंड पैरामीटर्स, स्पर्मेटोजेनेसिस हैम्पर हो सकता है. नेक्स्ट स्लाइड. नाउ हम एक केस को बारे बोल रहा है. ए 27 years old male presented with a complaint of pain in the right testicle for the past 4 to 5 days with a history of similar pain occurring on and off since 2023. The pain was described as stitching in nature. इनका stitching type of pain, and there is associated burning sensation, pain during micturition with no discharge. There is no history of trauma. Next, or fall. On general examination, the patient had a normal appetite with a marked desire for sour food. Thirst was normal and perspiration was more on the face. Bowel habits were regular and satisfactory. Urinary complaints included burning during urination. And the patient complaint was thermally hot and reported unrefreshing sleep. Needs सब ठीक ठाक नहीं होता due to occupational strain and some religious cause. Dreams were lascivious in nature. Mentally, the patient anxiety regarding his health and about his health condition, especially the varicose complaint. Next. Now, totality of symptoms क्या था? Anxiety about health, religion offering prayers daily, desire for sour food, burning sensation during micturition, perspiration, especially on face, sleep disturbed, not fresh, lascivious dreams, and pain in the right testicle and nighttime stitching type of pain in right testicle. Next. So on repertory करने के बाद क्या क्या दवा आया? सल्फर एंड रेटिनिया, रेटाम्यूल. So among them, next slide. Considering all these symptoms, sulfur 0/1 दिया, 2 medicated globules in 30 ml distilled water and 20 drops rectified spirit. Advice to be taken in the morning, followed by rubra. Next. नेक्स्ट फॉलोअप में देखा है कि ये पेशेंट राइट टेस्टिकल में थोड़ा पेन 30% कमती हुआ, नो बर्निंग सेंसेशन ड्यूरिंग मिक्चुरेशन, नो डिस्चार्ज, नाउ नो न्यू कंप्लेंट्स कभी और कुछ नहीं हुआ, और जनरल हेल्थ इज इम्प्रूव्ड. On 14th October, so there on 15th September, sulfur 0/2, same procedure was given, followed by rubram. Next on 14th October, so पेशेंट आया तो उसको इम्प्रूवमेंट देखा, तो हम लोग उसको रुब्राम दिया, देन sulfur followed by sulfur 0/3. Then on 15 December, pain got reduced by 80%, no discharge, no new complaint, and general symptoms are all vitals or are good. Then sulfur 0/4 given in same way followed by rubram. On 5th January 2026, patient complained that patient is telling that there is no patient is feeling better, there is no pain, pain on exertion occasionally. Then rubram was given. Next slide. So it is the our USG of the scrotum. It reveals that that is the 4th graded in the left side, 4th graded on 23 October, 2nd graded, 4th graded varicocele and mild hydrocele is there. On December 23, again USG scrotum done, test is done. It reveals that 3rd to 4th पोजीशन में फिर है, 3rd पोजीशन में है. नेक्स्ट स्लाइड. So this is the result. First initially before treatment started देखा है कि 27 अक्टूबर ग्रेड 4 था, 19th दिसंबर में बायलैटरल ग्रेड 4 था, उसके बाद 3 to 4 था, इन बिटवीन 3 to 4. नेक्स्ट स्लाइड. इसमें देखिए वो नियर अबाउट 10 months बाद देखा है कि नेक्स्ट ईयर में क्या हुआ ना, आफ्टर थॉरो ट्रीटमेंट द पेशेंट गॉट रिलीव. क्या हुआ देखिए, बायलैटरल 2nd ग्रेड वेरिकोसेल, सो 4th, सो 2nd ग्रेड में आया. इसके बाद पेशेंट आएगा तो हम लोग वैसा और ट्रीटमेंट कंटिन्यू करना, और वो पेशेंट विल कम, and now it is not yet come. Next. So result is 4th grade to 2nd grade में आया, grade 2 में आया varicocele, bilateral and minimal hydrocele. Next. Another case, it is also apparently looking surgical case. ये देखने में हम लोग का सर्जरी केस याद आता है, लेकिन हम लोग कब इसको सर्जरी में भेजेंगे और हम लोग कैसे होम्योपैथिक ट्रीटमेंट करेंगे, एग्जाम्पल हम एक केस दे रहा है. तो नेक्स्ट स्लाइड. डायग्नोसिस इज केराटिनियस सिस्ट. A keratinous cyst, what is the keratinous cyst? Is a benign, slow-growing cystic lesion arising from the epidermic or hair follicles infundibulum, lined by stratified squamous epithelial and filled with laminated keratinase, cheesy materials, in commonly occurs in the scalp, face, neck, abdomen, trunk. This case having near to the umbilicus. Next. हम पिक्चर दिखाएंगे बाद में, इसका बाद में है. इंडिकेशन फॉर सर्जरी, जब देखेंगे रिकरेंट इन्फेक्शन है, इंफ्लामेशन है, पेनफुल, टेंडर, रैपिडली सिस्ट ग्रोइंग हो रहा है, कॉस्मेटिक वैल्यू है, कॉस्मेटिक रीजन है, इसलिए पेशेंट ओरिड है, स्पेशली फीमेल. दिस केस इज फीमेल. रप्चर्ड cyst causing surrounding inflammation, reaction, abscess formation, and repeated foul-smelling discharge. So in this case, if we not treated well, if the homeopathic medicine is not responding, then we'll send the patient for surgery. Next slide. But here our treatment result अच्छा हुआ. Complication क्या होता है ये सर्जरी करने से? सर्जिकल साइट इन्फेक्शन हो सकता है, recurrence due to incomplete excision of the cyst, और hematoma होता है, और डिलेड वुंड हीलिंग होता है, स्कार फ्रॉम एक्शन और किलॉइड फॉर्म होता है, परसिस्टेंट पेन और टेंडरनेस रहता है, कभी कभी ऑपरेशन का टाइम में नर्व इंजरी हो जाता है, सुपरफिशियल नर्व्स इंजर होता है, और इसके बाद कॉस्मेटिक वैल्यू तो है थोड़ा कम है। नेक्स्ट, मैं एक केस आपको बोलने जा रहा है आप लोग को। ये 23 ईयर ओल्ड फीमेल एक पेशेंट, उसका ओपीडी का पेशेंट, तो उसका कंप्लेन था सॉफ्ट स्वेलिंग अराउंड द अम्बिलिकल रीजन फॉर द पास्ट 3 months। The onset of the complaint gradually through with a slow and progressive increase in size, and patient reported that the swelling would start oozing on slight pressure, and discharge is a scanty black colored liquid. The discharge was occasionally associated with a pricking type of pain with burning sensation, especially on touch, and there is a bleeding on touch. This is a specialty, and complaints aggravates at night. There is no history of trauma, fever, or similar complaints in the past. Next. So, based on the clinical presentation and local examination findings, the case was diagnosed as a infected केराटोनियस cyst, और इसका इंटरनेशनल क्लासिफिकेशन डिजीज है 11 कोड L72.9। डिफरेंशियल डायग्नोसिस हो सकता है सेबेसियस cyst, अम्बिलिकल ग्रैन्युलर लाइक दैट, बट इसको बायोप्सी किया, उसमें डायग्नोसिस हुआ केराटिनस cyst। Next, this is the biopsy report where it has written the keratinous cyst is there. Okay. Thank you. Now it is clear. Initially light is less. Now it is to some extent clear. So next slide. Clinical examination. On local skin examination, inspection revealed a black colored soft swelling located just above the umbilicus, measuring approximately 2 into 2 centimeter. The margins of the swelling were smooth and uniform. On palpation, the lesion was soft in consistency, tender, and showed bleeding on slight pressure. No surrounding erythema or signs of the systemic infections were noted. Next. Totality of symptoms क्या मिला? Bleeding on touch, complaints aggravated at night and by touch, pricking type of pain, burning sensation on touch, and scanty black discharge oozing on touch. Aggravation at night. Next. तो रेपर्टरी करके क्या क्या मिला? नाइट्रिक एसिड मिला, हिपासाल, थूजा एंड एकोनाइट कैमोमिला। तो इसमें नेक्स्ट स्लाइड। सब कुछ कंसीडर करके नाइट्रिक एसिड दिया था। फर्स्ट नाइट्रिक एसिड 0.1, देन अप्लाइड ऑन 23rd May 23 नाइट्रिक एसिड 0/2। तो 23rd May first follow-up, burning pain in the umbilical region reduced up to 40%, and blackish discharge reduced by 30%, and gels are good. So nitric acid 0/2 was given, followed by rubram. The patient reported on 14 July 2023, burning in the umbilical region reduced up to 60%. Occasionally, little bit burning is still there, and blackish discharge reduced, 50% reduced, and gels are good. So, as the patient is getting result, then no medicine, only rubram. But on 17th August, patient reported that burning pain in the umbilical region reduced 85%, not completely reduced, and blackish discharge reduced by 70%, but still it is running. Then again, nitric acid 0/3 was given and followed by rubram. Next. So on 23rd September 23, burning in the umbilical region reduced, blackish discharge slightly present, gels are good, so nitric acid, that will be nitric acid 0/3. And then on 17th October, as the patient was good, so the patient was good, that's why rubrum was given. Next slide. नेक्स्ट स्लाइड प्लीज.
एक मिनट सर, वो स्क्रीन डिसेबल हो गई है, मैं फिर से
ठीक है
स्क्रीन शेयर कर रहा हूँ.
ठीक है सर फुल स्क्रीन कीजिए, हाँ, एंड ब्राइट कीजिए थोड़ा. ठीक है सर. दिस इज द बिफोर ट्रीटमेंट ऑफ ए केराटिनोइड सिस्ट. यू सी ऑन द अपर पार्ट blackish just near about the umbilicus, and this is the bleeding is occurs. What I have explained, जैसा मैं बोला वैसा उसको बिफोर ट्रीटमेंट दिस कंडीशन में आया था. आफ्टर ट्रीटमेंट अब देखिए कैसे वो रिड्यूस हो गया. ठीक है, ड्राइड अप हुआ, ब्लीडिंग फुल स्टॉप है. नेक्स्ट केस. Next slide. This is a very important case. That is glioma, the brain tumor. It is very difficult to treat, and we are worried to treatment for this type of cases. But there are so many homeopaths, they are treating brain tumor and got result by the homeopathic medicine. So one of my OPD case, I am telling you, the gliomas are actually what happened. Glioma is a primary brain tumor arising from glial cells and represent a large proportion of CNS tumor. They include astrocytoma and oligodendrogliomas and glioblastoma. They can range from low grade, slow growing to high grade, rapidly aggravation, malignancy. Gliomas are also graded 4. The malignant, which is rapidly growing, and by histology we can see what is the after biopsy, after the brain operation, we can see that what is the nature of this cell. Otherwise it is not possible. Modern practice uses molecular marker. So by this marker indicated what type of progress is going on. Next. यस सर. इंडिकेशन ऑफ सर्जरी व्हेन हम लोग कब उसको भेजेंगे सर्जन का पास? मास इफेक्ट, इंट्राक्रैनियल टेंशन, प्रेशर बढ़ जाता है, सीरियसली हेडेक होता है, हम लोग का सिम्टोमेटिक मेडिसिन से कम नहीं होता है, रिकरेंट ग्लियोमा होता है, और न्यू ऑनसेट ऑफ सीजर, एपिलेप्टिक सीजर, कॉन्वल्सन एंड सेंसोरियम लॉस, vertigo and dimness of vision, double vision. All this intracranial pressure is raised. At that uncontrolled condition, we can advise to refer to surgeon. Otherwise, we can try with our medicine if symptomatic, if it is improved there. Next slide. And complication after surgery, there are so many complications of the brain tumor operation. इंट्राक्रैनियल हेमरेज हो सकता है, ब्रेन इडिमा हो सकता है, न्यू न्यूरोलॉजिकल डेफिसिट हो सकता है, सीजर पोस्ट ऑपरेशन होता है, CSF लीक होता है, वुंड इन्फेक्शन होता है, मेनिंजाइटिस होता है, वेनस थ्रोम्बो एम्बोलिज्म हो सकता है, इस्चेमिक स्ट्रोक हो सकता है. सो नेक्स्ट स्लाइड प्लीज. लेट कॉम्प्लिकेशन क्या होता है, बाद में क्या होता है? ट्यूमर रिकरेंस हो सकता है, न्यूरोकॉग्निटिव डिक्लाइन हो सकता है, एंडोक्राइन डेफिसिट हो सकता है, एंड रेडिएशन नेक्रोसिस हो सकता है. सो दीज आर द कॉम्प्लिकेशन एंड एलोपैथिक ट्रीटमेंट आफ्टर दिस इज द फेनोमेना. ऐसा हो सकता है. तो इसलिए हम लोग कोशिश करें सिम्टोमेटिक होम्योपैथिक मेडिसिन देके उसको ठीक करना. अगर नहीं होगा तब सर्जरी भेजेंगे. ठीक है, नेक्स्ट स्लाइड. तब मैंने एक एजेड पर्सन का केस मैंने बोल रहा है कि उसका 70 years old मेल फार्मर था, प्रेजेंटेड विथ कंप्लेंट्स ऑफ ग्रेजुअल प्रोग्रेसिव हेडेक. मेन प्रॉब्लम था हेडेक, हेवीनेस एंड प्रेशर फीलिंग एंड vertigo. frontal and temporal regions for the past 2 months. The headache was aggravated by physical exertion, motion, and exposure to sunlight, and was relieved by rest and staying in a dark room. Associated symptoms included vertigo, nausea, occasional vomiting. These are the common symptoms of space occupying lesion in the brain. Blurred vision, weakness, and imbalance while walking. These are the common symptoms of the disease, with mild right-sided weakness developing on time. Next. There was no history of trauma, fever, hypertension, diabetes, or previous major illness of this patient. Appetite, thirst were normal, bowel and bladder habits were regular, but sleep is disturbed due to headache. And general physical examination revealed that stable vitals with no significant abnormalities. BP pulse is more or less within normal limit. Neurological examination showed mild right-sided motor weakness, slight impairment of coordination, brain function, while higher mental function and cranial nerves were intact. Next. So it is the MRI scan of the brain. You see that the result, that is a space occupying lesion, it reveals that on MRI. Next, sir. Next. So it is the report. What is the impression? You see that the evidence of growth in the tumor, the glioma, is there. They are suggested maybe it is a neoplastic lesion. They are suggested maybe. Next. MRI brain revealed a space occupying lesion consistent with glioma, suggestive of grade 2 astrocytoma, with mild surrounding edema and mass effect. This, what is the report of MRI of brain that I am telling you? Based on clinical features and imaging findings, a diagnosis of glioma was made. So it is a case showed a predominantly syphilitic and myosinate background due to destructive and infiltrative pathology. Next. Totality of symptoms. क्या मिला हम लोग का? Fear of serious illness and anxiety about recovery, desire for quiet solitude and dark surroundings, irritable, sensitive, and easily disturbed by noise or light, vertigo, aggravation on turning head, aggravation on motion, amelioration by rest and darkness. Sleep was disturbed due to persistent headache. Hot patient, headache with heaviness and pressure sensation in the frontal and temporal regions. Pain aggravation on exertion, aggravation light, aggravation motion, amelioration by rest and darkness. Associated with nausea and occasional vomiting. Next slide. So टोटलिटी रेपर्टाइल टोटलिटी करके हम लोग देखा है क्या क्या मेडिसिन, कोनियम, फॉस्फोरस, कैलकिरिया, सैलिसा, these are the drugs. But conium got highest in 10 symptoms, 15 marks. So next slide. Next slide. So conium maculatum I have given on 20th May 2025. Low potency 6. Morning, evening, prescribed. Then I asked the patient to come on 23rd June. Then the features was complaint by the patient, headache, frequency reduced and intensity reduced, here about 70%. Vertigo easily normal, come down. General condition is a little bit okay, but there is coryza with watery discharge and sneezing. Then as the patient is improved, then Sabal Salvator was given due to there is some urinary trouble. and sneezing and coryza and allergic rhinitic symptoms are there. That's why Sabal Soldier 200, one dose given, stat dose, followed by Calcarea phos, 6s given. Then morning, evening, Calcarea phos given. Only one dose, Sabal Soldier दिया था. Next, on 5th August, headache reduced up to 90% and condition of patient is stable, vertigo absent, and patient is improved, appetite good, and emotionally state positive. Then I have again given Conium Max 6 morning evening. And next 9th September, no neurological deficit, occasionally mild headache, sneezing since 10 days. Again sneezing started. So again Sabadilla 201 dose given, followed by Conium maculatum 6 morning evening given. Next, on reporting on 6th October 2025, patient performing normal daily activities are without any discomfort, and the patient is sneezing completely reduced, and neurological state is intact and mild, shows slight depression with inactive. So the patient is mentally occasionally disturbed. Then Thuja occidentalis 1 dose given, followed by Conia maculatum morning evening for 15 days. So this is about the glioma patient. Patient got relief and it is maintained. तो अभी भी पेशेंट आता है 3 महीना 6 महीना बाद आता है, लेकिन पेशेंट बोलता है अभी ठीक है, ऑकेजनली वर्टिगो होता है, हेडेक कंप्लीटली गॉन एंड स्लीप भी इंप्रूव्ड हुआ. नेक्स्ट हेमोराइड्स केस. नेक्स्ट स्लाइड. Yes. External hemorrhoids are usually situated outside the anal orifice and is covered by skin. They lie below the dentate line and are covered by squamous epithelium. They receive sensory innervation from cutaneous branches of the pudendal nerve, making them sensitive to pain. That's why rectal pain is there. Next. Hemorrhoids may be distributed circumferentially beneath the anoderm and can occur at any position around the anal margin. Venous drainage of external hemorrhoids takes place through the inferior rectal veins, which ultimately drain into the inferior vena cava. Next, I am telling the venous structure. Condition that increase intra-abdominal pressure by any means then leads to straining during defecation, passage of hard stool, and in case of female childbirth, pregnancy advanced stage, lead to congestion of the hemorrhoidal venous plexus, and that leads to hemorrhoids. This venous engorgement may subsequently result in complications such as bleeding, thrombosis, or prolapse. Next. Symptoms of external hemorrhoids are most commonly due to acute thrombosis. This may be triggered by dietary alteration, severe constipation with excessive straining and physical exertion. Next. Indication for surgery. When हम लोग कब उसको सर्जरी में भेजेंगे? जब देखेंगे नॉन ऑपरेटिव मैनेजमेंट फेल्ड, एडवांस डिजीज प्रोसेस, कंजर्वेटिव ट्रीटमेंट नहीं रिस्पॉन्स कर रहा, हमारा होम्योपैथिक मेडिसिन रिस्पॉन्स नहीं करता, कंटिन्यूअस ब्लीडिंग हो रहा है, तब हम लोग भेजेंगे. मिक्स्ड हेमोरॉइड्स विथ ए बल्जिंग एक्सटर्नल कंपोनेंट, incarcerated internal hemorrhoids needing urgent intervention, तब उसको भेजेंगे सर्जरी में. नेक्स्ट प्लीज. हाँ, coagulation patient requiring management of hemorrhoidal bleeding. Patient experience symptoms related to external hemorrhoids or a combination of internal and external hemorrhoids accompanied by prolapse are strongly recommended to undergo hemorrhoidectomy. Next. The recommendation based on high quality evidence, including for patients who do not respond well or cannot tolerate office-based procedure, including rubber band ligation and sclerotherapy and infrared coagulation. Next, grade 4 case hemorrhoids we should send to the surgeon. कॉम्प्लिकेशन आप सर्जरी तो किया, उसके बाद क्या होता है? पेन एंड एनल फुलनेस विद इन फर्स्ट वीक फॉलोइंग हेमोरेक्टोमी हो सकता है. अर्ली कॉम्प्लिकेशन ब्लीडिंग, यूरिन रिटेंशन हो सकता है. रेयर बट लाइफ थ्रेटनिंग कॉम्प्लिकेशन सेप्सिस, एब्सेस फॉर्मेशन कभी कभी हो सकता है. नेक्स्ट, सो लेट कॉम्प्लिकेशन एनाल स्टेनोसिस, स्किन टैक्स, recurrent hemorrhoids. Next case, a 24-year-old unmarried male businessman. So patient attended the OPD and patient क्या है? Painful protruding mass था per anus, associated with bright red bleeding per rectum, burning, pricking pain, redness, swelling, and itching of the anal region for the past 3 years, occurring intermittently. Next slide. Over the last 4 months, the intensity and frequency of symptoms gradually increased, prompting the patient to seek allopathic consultation, where he was diagnosed as having internal grade 4 hemorrhoids. पेशेंट बोला कि सर्जन बोला कि आप सर्जरी कीजिए, तो पेशेंट सर्जन का बात सुन के डर गया. उसके बाद हम लोग का ओपीडी में आया. द पेशेंट का क्या कंप्लेंट था? कंप्लेंट्स आर एग्रेवेटेड आफ्टर कंजम्पशन ऑफ मीट ड्यूरिंग नाइट आवर्स and relieved by warm application. The patient also reported associated constipation with hard stool, pain during defecation, excessive straining, and passage of large amounts of flatus during stool. Next slide, please. These symptoms were accompanied by mild backache. Backache था, generalized body pain था, decreased appetite, thirstlessness, desire for spicy food, aversion to green leafy vegetables, and a white-coated tongue. Next slide. On local examination, क्या देखा? A tender, inflamed, protruding mass per anus was observed, consistent with irreducible internal hemorrhoids. I am showing the picture, the before treatment and after treatment. The patient led a sedentary lifestyle with irregular dietary habits, which are considered contributing to the factors. Actually, predisposing factors: irregular diet and eating meat and spicy food, non-veg. Based on clinical findings, the condition was diagnosed as internal grade 4 hemorrhoids. As per the surgeon, the most advanced stage characterized by irreducible prolapse, often requiring surgical intervention. This stage homeopathic treatment आया. तो उसका क्या totality symptoms था? Appetite increased, decreased, thirstlessness, tongue coated white, and desire for spicy food, non-veg food, especially meat, and mass per anus with pricking, sticking pain, and constipation with bleeding piles, protruding mass per anus with itching, hemorrhoids with swelling of anus, mass per anus with pains, aggravation at night, emulsion by warm by the application, occasionally cold application relief, mostly warm, much flatulence during stool. Next. So on the totality, repertorial totality, the medicine come the sulfur and some other medicine, but retenia like that, collinsonia, retenia, sulfur. These are the drugs usually come. Then Next slide. This is the picture of when the patient came is the first day on 23rd June 25. Bleeding, severely bleeding, prolapse of the hemorrhoidal vein. You see that hemorrhoids and very painful and bleeding, too much bleeding. Patient is afraid by seeing the condition. So for considering all these symptoms, कॉलिन्सुनिया 30C दिया for 2 दिन के लिए, followed by rubram. And after 1 week, I asked the patient to come after 1 week. तो 1 हफ्ता बाद आया. Based on the totality of the symptoms, कॉलिन्सुनिया 30C was given. तो वो 23rd जून में तो ऐसा हुआ, कॉलिन्सुनिया दिया. नेक्स्ट फॉलो अप 30th जून, 1 हफ्ता बाद. तो उसमें क्या किया, देखा कि पेन रिड्यूस्ड, माइल्ड, एंड बर्निंग इज रिड्यूस्ड, बट prolapse of the persist, tenderness is still there, stool slightly soft, and there is straining persist. The appetite improved. Again, Collinsinia 30 BD for few days we have given. Next follow-up, 14 July, the pain significantly reduced and occasional bleeding, prolapse of the reduced in size, stool improved in straining, general well-being improved, Collinsinia continued. Next on 4th August, patient report किया तो उसमें देखा occasionally mild discomfort in the rectal region, bleeding almost absent, prolapse markedly reduced, रेगुलर सॉफ्ट स्टूल हो रहा है, और पेशेंट एपिटाइट नॉर्मल हुआ. तो मैंने बैक एक था, इसके लिए उसको रेयर ब्लीडिंग नहीं होता है, इसीलिए बैक एक है, तो एस्क्यूलस हिपोकैस्टेनम 200 1 डोज दिया था. नेक्स्ट स्लाइड प्लीज. तो एस्क्यूलस देने के बाद वो अच्छा था, इसलिए उसको रूब्राम दिया था. Next time rubram. So this is the follow-up. Next slide. You see the first visit. देखिए 22nd June क्या कंडीशन था. आफ्टर 1 week 30th June देखिए उसका रिड्यूस्ड हुआ, ब्लीडिंग ऑलमोस्ट स्टॉप, एंड प्रोट्रूशन ऑल्सो देखिए 60% रिड्यूस्ड. And on 3rd visit 14 July, after 15 days, 14 July देखिए bleeding stop and reduce the prolapse of the hemorrhoids. And on last visit, the patient condition is on the 4th extreme right side, you see the condition of the patient. So almost cured, but I asked the patient to continue. Next case is varicose vein. Next slide. Next slide, please. Varicose vein. What is varicose vein? Varicose veins permanently dilated, elongated, and tortuous superficial veins, most commonly affecting the lower limbs, resulting from chronic venous insufficiency due to valvular incompetence and venous hypertension. Next. They predominantly involve the great saphenous vein, usually in the lower. Great GSV means great saphenous vein. SSV means small saphenous vein, or their tributaries, and may present with aching pain, heaviness, edema, skin changes, venous ulceration. Varicose vein represent a progressive disorder of venous circulation and are classified under chronic venous disease CVD using the CAP classification. Next, surgical approach. When we send the patient for surgery, congenital surgical procedure, high ligation, and stripping of GSB and SSB, removal of incompetent saphenous trunk, multiple stab avulsion, phlebectomy. In this condition, surgical approach ऐसा surgical क्या करता है? This is the procedure of surgery. Next. This is also surgical interference, what they are doing. Next. Indication for surgery. क्या देखेंगे जे सर्जरी का क्या इंडिकेशन है? हाइपरपिगमेंटेशन हो गया, एंड लिपिडोमाटोस्क्लेरोसिस हो गया, वेनस एक्जिमा हो गया, सीवियर स्वेलिंग पेडल इडिमा हो गया, अल्सरेशन सीवियर हो गया, तो अब हम लोग इसको भेजेंगे और हम लोग का इन्वेस्टिगेशन करेंगे कलर ड्रॉपलर लोअर लेग्स. नेक्स्ट, venous ulcer, recurrent superficial thrombophlebitis, bleeding from varicosities, progressive venous disease and cosmetic indication. ये होगा तब हम लोग कर सकता है if our medicine is failed. Next, कॉम्प्लिकेशन सर्जरी होता है, हिमाटोमा होता है, वुंड इन्फेक्शन, ब्लीडिंग, सुपरफिशियल थ्रोम्बोफ्लेबाइटिस. नेक्स्ट, लेट कॉम्प्लिकेशन, रिकरेंस वेरिकस वेन and persistent edema, skin pigmentation, etc. etc. Next case, a 32 years male patient came with complaints of dilated veins of bilateral lower limbs for 6 months. 6 महीने के लिए उसका दोनों पैर ऐसा हुआ, लिम्स थोड़ा इन्वॉल्व हुआ. देयर इज बास्टिंग पेन. पेशेंट सेज ये पैर नीचे करने रखने से उसको बास्टिंग पेन होता है. क्या हो रहा है? एंड occasionally cramps in lower limbs, aggravation by prolonged standing. Next, his appetite is good. He usually takes water in large quantities in long intervals, desires spicy food, and has a habit of taking tea 2 times per day. He is a hot patient. Next, this is a past history of chickenpox at the age of 10 years. There is no specific illness in the family. Next, on local examination, there were superficial dilated veins, greenish over both lower limbs, greenish bluish appearance. Next, color Doppler was done. Doppler ESG confirmed that he has few superficial veins are seen on medial aspect lower 1/3 and upper 1/3. Was diagnosed as varicose veins. Next, totality: desire spicy food, profuse perspiration on face during heat, bursting pain on lower limbs at dilated veins, varicose vein with itching, and cramps in lower limbs. Next, this is the USG color Doppler of the lower limbs. तो उसमें डायग्नोसिस हुआ कि उसका वेरिकोस वेन है. नेक्स्ट, प्रेस्क्रिप्शन: वाइपेरा 202 drops in 60 ml distilled water with 20 drops of rectified spirit to be taken 1 spoonful medicine 1 day alternately morning for 21 days. और उसके साथ कैलकुलेटर फ्लोर 6 दिया, 3 drops आफ्टरनून एंड नाइट, followed by this medicine. Next follow-up, it is not very small. Before that, so it is itching reduced by 80% on the legs, and pain and swelling reduced 20%, no new complaints, and gels are good. Medicine Vipera 200 was given, followed by calcarea floor 6x given 2 times BD. And next 9th December 2025, patient reported that itching reduced completely, pain and swelling almost 50% reduced, and no new complaints. All channels are good. So varicose vein, Vipera 202 dose given, 2 drops in 60 ml distilled water, given in distilled water, and to be taken 1 day alternately, followed by calciferol 6x. Next. So this is the picture on 18th October 2025, and this is 9th December 25. After that, I advise further color Doppler, but they are not reported me. So I can't show you the further. Yes. So I hope so. There is time is up. There is another case. Shall I continue or stop here? Ligament tear is there. There is a case. So in a nutshell, can I say?
सर अभी टाइम है सर, अभी अभी 7 मिनट
अच्छा
बचे
ठीक है,
हुए हैं.
ठीक है सर. Next slide. Ligament tear. A ligament tear is an injury involving partial and complete disruption of the fibrous connective tissues that stabilizes a joint. Okay, so occurs due to sudden trauma, twisting and overstretching, or direct blow leading to pain. So this is the ligament or types of surgery: ligament repair, suturing of the torn ligament. If it is a complete tear, then we must send the surgeon for ligament tear, complete tear. Partial tear, we can take the help of homeopathic medicine. Next slide. Next slide, please. Yes. Indication of surgery: complete ligament tear, persistent joint instability, failure of conservative management, and homeopathic treatment, allopathic treatment, medicinal treatment. If it is failure, then young active individuals, athletes, so they must go for surgery for repairing recurrent episodes of joint giving way. Associated injuries, if it is there, then that should be corrected by surgery. Next. Complication of ligament surgery: infection and delayed wound healing. Next. Case: a 64 years old female came to the OPD with the complaint of pain in left knee joint since 7 days. Very much severe pain. The patient went to surgeon, but surgeon said that you need operation. तो पेशेंट घबरा गया, तो होम्योपैथी में आया. तो मैंने देखा ये पार्शियल टीयर है, तो वी कैन ट्राई विथ होम्योपैथी विथ क्रेप बैंडेज एंड कंप्लीटली रेस्ट एडवाइस किया. द पेन फॉलोड आफ्टर एन इंजुरी फॉल फ्रॉम द बाइक. Pain is very sensitive, can't move her left knee, and pain is aching type. The part is very sensitive to touch. Left knee joint feels as if it was sprained. Aggravation while moving and the left knee. Exertion affected knee. Exertion, emulation by rest and pressure. She had been to allopathic hospital, but there she was diagnosed as a case of ligament tear of left knee through MRI scan. Next. So she is hypertensive and on regular medication since last 7 years. Family history revealed hypertension. And next, she was ambithermal. She was sleeplessness because of the pain since 7 days. Mentally, she was very worried about her condition. And on general examination, the patient was moderately built and nourished, and pulse is rate is 76 per minute, 76 beats. And pressure 140 by 90. Next. Next. Systemic examination all revealed there is no others abnormality. Local examination of the left knee joint, on inspection, the blackish bluish near the lateral side of the knee, and revealed restricted and painful movements in all directions. Next. Next. Yes, this is the MRI of the patient. It reveals that the partial tear of the ligament tear. Next, sir. On right side, there is a suggestion. What is the diagnosis on the right. Next slide. So totality of symptoms after fall injury: pain in left knee, joint aching type, pain as if sprained, and aggravation by touch, aneurysm by rest, sleepless, and blackish discoloration, ligament tear of the knee joint. Next. Next slide.
1 second सर, बारिश की वजह से थोड़ा सा नेटवर्क इश्यूज है थोड़ा सा।
हाँ, अच्छा हो सकता है सर, हो सकता है। If it is not available, then I say the case only, what as the treatment was done. Next. Yes. So on 25th May, patient having pain in left knee, and there is a pain in the arthros joint, and in the knee joint there is a swelling, pain and blueness. Arnica 200 given. First morning, evening, 3 days, 3 days diya. Advice, completely rest and make a crepe bandage. And Vascal is 10, pain is 10 out of 10, 8. Vascal. Next. So on 12th June, pain in left knee decreased 10% only after taking rest. Pain as if and after taking the medicine. Then pain as if sprain, unable to walk and move joint and sleep better. But then followed by arnica, followed by ruta was given 200, 2 drops in distilled water 60 ml to be taken 1 day alternately, morning, followed by rubram. Then on 15 July, pain in left knee reduced 35% and all journals are good. Ruta 1 m, 2 drops in 60 ml distilled water, 20 drops RS to be taken 1 day alternately. And
Sorry to interrupt you, sir.
Yes, sir.
हमारा टाइम अप हो चुका है सर।
Okay, sir. Okay. So the last, this patient is cured by the Ruta 1M and 80% got relief. Thank you.
Thank you so much, sir.
Yes, sir.
थैंक यू सर, बहुत अच्छा लगा सर आपका। समर चटर्जी सर, बहुत बढ़िया लगा। बहुत एविडेंस बेस आपने जो है प्रेजेंटेशन की है। लेकिन हम लोग तो 45 मिनट से ज्यादा क्लास नहीं लेते हैं। आपका तो सही था, मॉडरेटर आपका सही नहीं किए, उनको बोलना चाहिए 5 मिनट पहले छोड़ दीजिए। या हमारा सजेशन है, आपका आप सही थे सर, आप पूछ लिए थे। मॉडरेटर को चाहिए इसमें 5 मिनट 2 मिनट पहले ही छोड़ने का। ठीक है, ओके सर, बहुत बहुत धन्यवाद।
थैंक यू सर, थैंक यू।
डॉक्टर उमेश सर, ओवर टू यू।